Hello everyone, this is Dr. Jayakrishna. I am working as a senior orthopedic and joint replacement surgeon in Union Hospitals, Vijayawada. Today we are going to talk about osteoarthritis problem. So what is osteoarthritis and what are all the treatments available for that? So osteoarthritis is loss of cartilage. So especially osteoarthritis problem, we can see in knee joints as well as hip joint. So out of 100 patients, 80 patients come with the problem in the knee, and 20% of the people come with the problem in the hip. So the most common osteoarthritic problem we see is in the knee joint. So whenever a patient comes to us with the knee pain, so we evaluate them with the X-ray, and when we take an X-ray, the osteoarthritis it is in which stage we can understand. So there are 4 stages in osteoarthritis, from early to the severe stage. So from X-ray, when we find out that if it is an early stage, we usually prescribe some pain medication and also some joint lubricants like glucosamine. So only when the patient is in the 4th stage, we usually advise surgery for them. So it's not that every patient with osteoarthritic change, 4th stage osteoarthritic changes we find in the X-ray doesn't need surgery. Along with the X-ray changes, if the patient has a lot of pain, if he is not able to walk a minimum of 200 meters, if he needs to take pain medication every day, then only we suggest knee replacement surgery. So what happens in osteoarthritis is every joint has a cartilage. In the bone ends, they have a cartilage layer. So the osteoarthritic changes means the loss of cartilage. So when there is a loss of cartilage, so the joints ends will become rough, and due to this the patient will experience pain. So what we do for the surgery is we just trim off the ends of the bone, and we'll just put the new implants. One implant to the femur, one implant to the tibia, and in between the insert. Patients when diagnosed with first or second stage of osteoarthritis, we usually prescribe some medication and also some lifestyle modifications like not sitting on the floor and also not to use Indian toilets and everything. And also they need regular exercise, and also they have to control their weight. So how would be the recovery after the surgery, joint replacement surgery? So immediately one day after the surgery, we will start physiotherapy, and we will make patient walk along with the support and also with the walker. So within usually patient stays up to 3 days for one leg and 4 to 5 days for both legs. So by the time of discharge, on the 3rd day, they will be able to go to the bathroom on their own with the help of walker. And after that, when the patient is comfortable, when they are able to go to the toilet by their own, we will discharge them. After going home, they need physiotherapy for another 10 to 15 days. So by the time of 15 days, they will be able to walk without any support. They can climb the steps. Only precaution we tell them is not to sit on the floor.